Good morning, good evening, good afternoon, depending where you are based, and welcome to this very important webinar on Life-Course Immunization, a call to action, organized by the World Federation of Public Health Association. I am Marta Lomazzi, Chief Operating Officer of the World Federation of Public Health Association, and I'm really delighted to be here today with an incredible panel of senior representatives of key NGOs working in the health areas and joining forces with us today to call for a life-course immunization. I would like to very briefly introduce you our panel of experts before digging into the different aspects of the call to action and ways to implement it. Next slide, please. So I have the great pleasure to welcome today the representative of the International Federation of Aging, Mr. Graeme, the representative of the World Medical Association Junior Doctor Network, Dr. Balkis, the representative of the International Federation of Medical Students Association, Mr. Very soon, doctor, I hope, Mr. Zaineldin El-Mikati, the representative of the International Council of Nurses, Mr. David Stewart, the representative of the International Pharmaceutical Federation, Mr. Paul Sinclair, the representative of the World Organization of Family Doctors WONCA, Mehmet Akam, the representative of the World Medical Association, Dr. Yasen Cholokov, the representatives of the International Pharmaceutical Students Federation, Ms. Tanushree Ian, and last but not least, Dr. Michael Moore, past president of the World Federation of Public Health Association and chair of the International Immunization Policy Task Force. And of course, I would like to thank all the members of our task force for the great work they do on immunization, as well as all the members of our organization that will join force for the implementation of this call to action. So I will give you some more information later on of all the speakers, but let's start with the first contribution from Dr. Michael Moore that will give you an highlight of why this call to action endorsed by so many organizations, key organizations in the health area, is so important. Michael was the CEO of the Public Health Association of Australia, former president of our organization, and also the chairperson of our International Immunization Policy Task Force. Michael, over to you.
Thanks very much, Marta. And look, I want to say thank you for everybody who's involved. And Marta has already acknowledged those. And of course, we also like to acknowledge the support we've had from the staff and members of the World Federation of Public Health Associations, University of Geneva, and Pfizer, along with the people who have been heavily involved in it. So what's it about? Well, if we're going to have resilient health systems, then we need to work effectively in vaccination. We need to work with individual health workers, their families, patients and the communities they serve, the healthcare systems and broader communities. So when we got together to work out what is the most effective way to deliver life course immunization and what impact will it have as part of our call to action, we said this is where we think the focus would be. Of course, a broader community in the end, but leading into that, particularly with healthcare workers and those around them, because remember, it has the impact on their own health, but also has the impact on the health of those around them. And the other element about healthcare workers in particular, and that's the group that we've brought together, is that they are huge influencers, to use a modern jargon, with regard to something like vaccination. So it becomes very important. So what is it they've actually said? Well, here it is, the call to action. And we're looking about ensuring that vaccines are accessible, affordable, and available to health and social care workers so that we can ensure that vaccine preventable diseases are reduced, and particularly in high population groups. And it's interesting to note the spread of some completely vaccine preventable diseases such as measles at the moment in a range of countries. And yet we know that the measles vaccination is basically a sterilizing vaccination, but it also applies to ongoing deaths and sickness associated with things like influenza, COVID, RSV. These are largely preventable, certainly reduced in life course with appropriate vaccination, and similar thing with diseases like tetanus, with shingles. So we need to think about it very carefully, but as always in public health, it's got to be about equitable access to these, and that the access is tailored to each stage of life. I mentioned mobilizing the health workforce because the health workforce is so influential with regard to influencing people regarding such things as vaccination. And it'll be so much more helpful if we had a clear vaccine schedule for adults. And we have a brilliant one for pediatric vaccine in almost every country. And they're very similar. But adult life course vaccination schedules are only in the early stages of being developed. And we need to actually ensure that they are supported by robust, interoperable immunization registers. And, you know, most countries through COVID did open registers and began to work on them. Now we need to build on that and make sure they apply right across the life course, and we make sure that we integrate the vaccination in multi-sectorial policy and priorities across a whole range of health issues, and to do that, get appropriate vaccination pathways. I've emphasised whole of life. I'll emphasise it again as we build vaccine confidence. And to do that, we need to develop and integrate in community priorities and community engagement. You'll never be successful if we don't engage, particularly things like community leaders and faith leaders, to ensure that we can help deliver a life course approach. And finally, right through from youth, and starting, for example, with the HP vaccine, right through to aging, we need to have the support of health organisations and professionals. And that's why it is the World Federation of Public Health Association is so proud to work with all of the groups that we have on board today, and we're intending to broaden that group as well. So the challenge is ahead of us. I think, however, despite the fact that we see reduction in vaccination, particularly in older adults since COVID, I think that it's a challenge that we are able to meet. It's going to be a lot of work, and so we've got to get underway with it. Marta, thank you very much.
Thank you very much, Michael. And let me link up to your last point about the need to work together and the power that we have in this room, virtual room today, bringing together all our organization. We have started with this journey last fall, discussing immunization. We all know that immunization is important. All our organizations are touching some aspects of immunization, but the power that we have today is that we are joining forces for a unified call to action covering the life of every individual, representing our membership or the communities or the people that are the basis of our organization and our communities. And this is extremely important. And even if it's just the first step, it's very, very promising. And I'm really glad to be here today and to discuss with each of you about the key area of this call to action the part that speak most to your organization first, and afterwards we will discuss about the implementation. So I would like to open now the panel discussion with all our esteemed speakers and invite them to comment on the statement and to highlight the part of the statement that are particularly important for the organization they represent. And I would like to start with Professor Mehmet Akam, that is a general practitioner and professor working in the field of primary care, chair of the WFPHA Working Party on Research, executive board member of the European Forum for Primary Care, and the department head of family medicine at the Marmara University. Mehmet, over to you.
Thank you very much, Marta. I'm honored to represent WFPHA, the World Organization of Family Doctors, today, and to fully support this vital call to action on life-course vaccination. Well, at WFPHA, we firmly believe that vaccination must be embedded across the entire life course. So not only limited to early childhood, but extending to adolescence, adulthood, and the older age. So the family physicians in that sense are central to achieving this vision. So we deliver continuous and trusted care across the generations. We are deeply embedded in the communities and positioned to protect and advocate for the health of individuals, families, and societies as a whole. So at this pivotal moment, I would like to have some clear messages actually to the some important audiences of this call and the target groups especially. For the policymakers, please make adult and life course immunization as a national priority. Invest in health systems that make vaccines accessible, affordable, and trusted at every stage of life. And for the healthcare professionals, be proactive and vaccine advocate. Integrate vaccination conversations into everyday care. Address hesitancy with empathy and lead by example. And to the public, vaccination doesn't end in childhood. Staying protected throughout the life strengthens your health, safeguards your loved ones, and strengthens your community. Trust your family doctor, and we are here to guide for you. Life course vaccination is not only a health intervention, it is an investment in resilient health systems, health equity, and social solidarity. So WFPHA stands ready to collaborate with governments, partners, and communities to turn this shared vision into an action, and we fully support that. Thank you very much.
Thank you very much, Mehmet. And I keep among all the very important suggestions you gave, one of the last point, invest in immunization to safeguard your loved ones. And this applies to everyone at every stage of life and is the driving force that we should apply to make sure we have a life course, whole society approach to immunization. I would like now to invite Dr. Yasen Cholakov, a public health physician from Canada representing the World Medical Association, to share his thought. He is the head of infectious disease at the Nunavik Department of Public Health, where he leads efforts to prevent and control infectious disease in a remote indigenous region facing significant structural barriers to health. And he also served as assistant professor in the Department of Global Public Health at the McGill University. Yasen, over to you.
Hi, thanks for having me. So I think it's important that we're taking a moment today to recognize that vaccination remains one of the most effective public health interventions. But we're also living in quite difficult times for health all around the world. Health systems are struggling with ever-growing fiscal constraints, given the geopolitical turmoil and the situation of the world economy. We're also seeing major losses in funding specifically for health around the world from some of the biggest funders that we had before. And we've seen also regular attacks now on confidence and in trust in public authorities, but in with regards to health, and more specifically yet with regards to vaccination. So the WMA welcomes this call calls emphasis on protecting health and social care professionals and recognizing them both as a priority population for immunization, given the work that they do, but also as critical advocates for their communities. Equitable access to vaccination across all stages of life must be ensured, but we must also make sure that we reach populations that face structural barriers. We also wish to reaffirm the importance of public trust. Vaccination programs must be safe. We must have transparency in the information that is collected and that's shared. And we have to embed strong public education efforts within those programs. Combating misinformation and maintaining public confidence is essential. And we wish to underline that health professionals and associations and structures, regulatory structures around them have an important role in combating misinformation. And we must ensure that health professionals are playing that role, but also very importantly so, that health professionals are not spreading further disinformation. Finally, we support the broader vision articulated, strengthening surveillance systems, investing in health systems and health workforce capacity, empowering youth and aging populations to actually champion vaccine initiatives. So the WMA is committed to continue advocating for these shared goals and encouraging all stakeholders to actually take a proactive role in promoting life-course vaccination as a global health priority. Thank you.
Thank you very much, Justin, for your word about the importance of building awareness and trust, and to maintain this trust also through an appropriate reporting, and to making sure that all the process related to vaccination is safe, so can be trusted. And this is a key area, not only for our community, but also for the health professional our organization represent. I would like now to invite Dr. David Stewart, Deputy Chief Nurse at the International Council of Nurses, to share his vision and thought. He leads global nursing policy development, strategic initiatives, health system reform within ICN. With over 2 decades of leadership experience, he has worked alongside international organizations, driving key policy advancement, including prescriptive authority for nurses and significant health reform across multiple countries. David, over to you.
Yeah, thank you very much, Marta. And I appreciate the comments that have been made from the speakers before, and also the call to action itself. And at ICN, we thoroughly endorse this call to action. And in particular, I want to focus on a couple of things for us as an organization. In particular, is that all recommended vaccines are accessible, affordable, and available in health, which is exceptionally important, not just across the life course, but particularly for health workers as well. We know that nurses, particularly, and other health professionals on the front lines of care need to be also protected as well, being exposed to various hazards. So we need to have this as part of the call to action. In addition, we recognize that vaccinations and the return on investment, we've heard about some of the challenges, particularly with the financial instability. We must keep remembering that health is one of the biggest economic drivers and one of the best drivers of this. And the return on investment actually comes through life-course vaccination, through healthy people, hospital avoidance, or higher forms of treatment. And so in line with that is one of the call to actions points as well, which is expanding and simplifying vaccination pathways by diversifying providers and service points. We believe that there is very key roles to be played by a lot of different health care providers, but we recognize that nurses are often touch points at so many different parts of this journey, whether it even be through the transportation and the supply chain of vaccinations, all the way through to delivery, dispensing, and even through the recording of that information. And Michael touched on before just about the necessary instruments of actually having better documentation in relation to this. And nurses are those key elements in actually enabling that to occur. But we've also heard a couple of points that were touched on before, just about key things about health professionals being the trusted source of information, regaining that trust with the public. And it's important that we continue to provide the level of investment related to professional development, education for health professionals, not just within the primary care setting, but also in the community settings, in the schools, in the prisons, in the long-term care facilities, in the hospital, in the acute care setting, right across the continuum of those healthcare providers, because it can't be just left to a dedicated few. And we need to start looking at this as a whole of health system approach to it. So expanding and simplifying these pathways is a critical point that we see in being able to achieve what is being set forth in this call to action. And so at ICN, we support a number of things. We support particularly the education of the rollout of professionals development for nurses, mandatory immunization policies for healthcare workers to protect them. Also looking at some of the key barriers and how we can address some of these issues with vaccine hesitancy. And so I think as health professionals are trying to navigate this very complex time, I think the messaging needs to be very clear that there is a great health benefit, there is a significant return on investment, and it's not just any single one point, it's across the continuum of providers. So thank you very much, Marta.
Thank you, David. Your final message speaks to each of us and is very, very important, on top of the fact that we need to make the vaccination path easy, accessible, and equitable for all the healthcare workforce first, and then for all our communities. I would like now to invite Dr. Paul Sinclair, representing FIP. He is the president of the FIP and has had senior leadership role within this organization, the Pharmacy Guild of Australia, the Pharmacy Council of New South Wales, and the Australian Association of Consultant Pharmacy. Paul has had significant experience in dealing with senior Australian government politicians and bureaucrats negotiating community pharmacy agreements on behalf of Australian pharmacists. Paul, over to you.
Thank you, Marta. And it's a pleasure to be here tonight amongst this esteemed group of practitioners. FIP supports this call to action to advocate for Life-Course Vaccination. FIP has a prevention program which has a key element to enhance the role of pharmacists in improving vaccination coverage rates throughout the life course. And this aligns very strongly with the WHO global imperative of leaving no one behind. We are committed to transforming vaccination by accelerating vaccine equity, access, and sustainability through life course vaccination. Through our involvement in life course vaccination, pharmacists and FIP aim to advance global immunisation by ensuring people of all ages receive timely, life-saving vaccinations for better health and well-being. We aim to have enhanced collaborative efforts with the World Health Organization, other healthcare professionals, and allied civil society organisations to tackle vaccine hesitancy and complacency, driving action to safeguard vaccination coverage and strengthen global immunity against preventable diseases. We aim to champion pharmacists as key players in life course immunisation, tackling vaccine hesitancy, misinformation, and complacency. By empowering the pharmacy workforce, we believe we strengthen public health worldwide. Pharmacists, by and large, in many settings, are underutilised. We look to leverage the capacity, accessibility, and trust of the pharmacist in all practice settings to improve health outcomes, particularly through administration of vaccine and particularly through a commitment to life course vaccinations. Thank you, and it's FIP supports this call to action and all of the initiatives included within it. Thank you.
Thank you very much, Paul, and very important, we need to make the best use of the healthcare workforce that we have. We are observing everywhere in the world a shortage of the healthcare providers, and we are not always using at best the incredible human resources that we have around the world. So very important, your call to make sure that we are getting the best out of the different professionals we represent within the immunization context, but also beyond, to make sure we have a stronger health system around the world. I would like now to invite Dr. Graeme Prieur, co-founder and CEO of Whole and Prior Health and Aged Care Group, and also the president of the International Federation on Aging. He holds several key roles in global and national aged care organizations. He is dedicated to advancing inclusive, high-quality aged care, supporting research, and leading sector innovation to meet Australian growing needs. We are surrounded by Australians today. Graeme, over to you.
Thank you, Marta, and everyone here. It's a pleasure to be here. And the IFA, I can say, is almost obsessed about vaccination for every person on the globe, particularly the older populations. So just a few background notes. We are focused on improving vaccination globally as a priority of the International Federation of Aging, as a key contributor to healthy aging. The IFA, across more than a whole decade, and through all of its activities, has launched the Vaccines for Life program, has worked alongside many committed organisations to address barriers to improve adult vaccination rates in the context of healthy aging. Framed by three intersecting intentions in the principles of prevention, access and equity, Vaccine for Life program, excuse me, turn my phone off. Turn itself off. To be a reliable source of information, evidence and good practice across sectors and disciplines on the link between adult vaccination and healthy aging. And that's our key point I want to make today, and I'll close on that in a few moments. To mobilise knowledge, experts and expertise through the creation and use of innovative platforms and channels of communication. And thirdly, to influence and help shape policy related to adult vaccinations and at-risk groups through capacity building at the national and international level for all countries, and particularly following the decade of healthy age, its implementation. The key point for us at the IFA is the invisible nature, the way older people are sometimes forgotten about, and they're invisible in our communities. And we are very concerned that the older adult population will be seen as being less important going forward in major debates around the world. And that's where we get particularly excited about. That's the key point I want to make, and that is to ensure that the at-risk populations, the people over the age of 65 with multiple morbidities, trying to access long-term care, trying to find primary health, trying to deal with the lack of money, lack of revenue, lack of income protection. These people are very, very vulnerable. And we saw that vulnerability in front of all of our eyes throughout COVID. And the IFA was there in the trenches, in the boardrooms with governments, and we totally support the call to action, and particularly for older adults throughout the world. Thank you very much.
Thank you very much, Graeme, for this call to not forget the invisible, that are the older adults, but also all the other minorities or vulnerable groups in our world, indigenous people and other minorities that need to be protected, because they are those that pay most when there is a problem in the health system, when we had the pandemic, or when they are not able to be reached by appropriate vaccination, educated on the need to be vaccinated, etc., and beyond also peer vaccination. I would like now to move to Tanushree Yan, the chairperson of public health at the International Pharmaceutical Students Federation. She's a pharmacy graduate based in India, chair of the Health Education and Literacy Working Group of WHO Youth Council, and spokesperson of the Global Youth Voice at the Global Center for Good Governance in Tobacco Control. Over to you, Tanushree.
Thank you, Marta. Good morning, good afternoon, and good evening to all the people who have joined us from different time zones across the world. It's an honor to be here today to support this crucial call to action on Life-Course Vaccination led by WFPHA. We at IPSF believe that one of the most urgent and impactful levers for change is empowering the current and next generation of the health workforce to build vaccine confidence and ensure equitable immunization across all ages. Why this focus area matters to IPSF is because vaccines are among the most effective public health tools we have, saving millions of lives annually. Yet, the resurgence of vaccine-preventable diseases and the growing threat of vaccine hesitancy puts this progress at risk. As future pharmacists, the most accessible healthcare professionals in many communities, our members are uniquely positioned to bridge gaps in immunization by educating patients on vaccine schedules, benefits, and safety, combating misinformation at the grassroots level, and delivering vaccines, especially in underserved and remote areas. IPSF's 2019 Declaration on Vaccine Hesitancy already laid our commitment to this mission. We called for legal frameworks to allow trained pharmacists to administer vaccines, inclusion of immunization training in pharmacy curricula, and community-based campaigns that reach vulnerable populations with trusted, culturally sensitive messaging. We also advocate for lifelong vaccination strategies, including equitable access to vaccines across all life stages and to all sexes, and the development of halal and vegan-friendly alternatives where it needed. This call to action rightly places emphasis on mobilizing the health workforce and integrating youth in life-course immunization efforts. We strongly support these principles, especially the points that call to leverage critical role of youth organizations to build capacity and champion vaccination initiatives among healthcare workers and their communities, and raise awareness about the value of vaccination through the whole of life and build vaccine confidence. IPSF is committed to building the competencies of our members, not only to deliver immunizations, but also to act as champions of trust, equity, and evidence-based public health. We stand ready to collaborate with governments and NGOs to strengthen vaccine education and delivery, expand our campaigns globally to address the vaccine hesitancy, and partner with academic institutions to integrate immunization more fully into pharmacy education. Let this call to action be more than a statement. Let it be the moment we empower a generation of healthcare professionals, especially young pharmacists, to lead by example, inform by fact, and act with compassion, ensuring immunization for all at every stage of life. Thank you.
Thank you very much, Tanushree. And this is really a call to action and a clear path we all need to follow, because as you and the next two speakers representing young professionals, you really need to be the driving force of these changes. It's my pleasure now to introduce Zaineldin El-Mikati. He's a fifth-year medical student from Alexandria, Egypt. He plays an active role in the International Federation of Medical Students Association and currently serves as the External Affairs Assistant for Member Engagement in the Standing Committee on Public Health. Over to you.
Thank you so much, Marta, for this chance to speak, and I hope everyone is having a good day wherever you're connecting from. Hello, everyone. I just want to really echo the whole call of action and every point that's been raised in this amazing panel. And I really want to emphasize on the call action number 8, which is to raise awareness about the value of vaccination through whole life and build vaccine confidence. It is absolutely critical because even the best immunization programs collapse if people don't trust them. And as positioned as future doctors, the IFMSA represents over 1.5 million medical students. And we know that facts alone don't change minds. It is the heartfelt conversations, it is the relatable stories, and the visible leadership that tip the scales. And that is why the IFMSA will work hand in hand with our national and local organizations to push for policies mandating regular vaccine confidence training in medical curriculums, and also equip students to run campaigns, awareness campaigns to the public, where we can share best practices, we can share peer-to-peer education and capacity building sessions, where we can equip the future generation of doctors to be able to have these conversations and be able to deal with difficult mindsets and able to change perspectives on vaccine hesitancy. This mixed approach, blending policy advocacy and on-the-ground outreach with capacity building and utilizing digital platforms to share storytelling. We can turn the call to action number 8 from just bullet points into real lasting trust in every community we serve. So because if we want lifelong vaccination to succeed, we need lifelong trust. And that starts with us, for sure. Thank you so much, Marta, for this.
Thank you very much, Zaineldin. I like your quote, facts don't change mind, but I'm sure the new generation will change mind and make sure we have a different approach to vaccination in the different communities. And last but not least, I would like to introduce Dr. Balkis Abdemoula, a Tunisian trained medical doctor specialized in family medicine with a master's degree in environmental public health, health economics and management, data analytics and biostatistics. She serves in the leadership role within the World Medical Association Junior Doctor Network, WHO Youth Initiative, and the MENA Coalition for HPV Elimination, among others. She's passionate about advancing universal health coverage, health policy reform, and global health advocacy. Over to you.
Thank you, Marta. Thank you, everyone, for your great interventions. And I'm really happy to join this great panel today. As a junior doctor and a representative of our Junior Doctors Network, which is the youth voice within the World Medical Association, I would like to mention that we're every day on the front line of care, listening to patients, building trust, and seeing firsthand how preventable illnesses can derail lives, families, and health systems. That's why we strongly support this global call to action for Life-Course Vaccination. We believe that vaccination isn't just a pediatric issue, it's a lifelong commitment to health and equity, and yet too often adults, including health and social care workers, remain unprotected, under-vaccinated, and overlooked. We believe this must change, and we are calling for a future where every stage of life is covered by a robust, equitable, and accessible vaccination program or national programs, and where also healthcare workers, including the junior doctors, are not only protected but empowered as advocates or immunization advocates within their communities. This means ensuring access to all recommended vaccines for health workers, expanding adult immunization schedules as part of routine care or universal immunization, and building real-time immunization tracking systems, and actively involving youth voices like ours in shaping these policies and programs. Once again, as junior doctors, we are really ready to lead by example, to speak out with scientific clarity, but also to build confidence and trust where doubt or misinformation exists. We know there is a lot of stigma around vaccines like HPV that I'm personally working on, and in a region like mine, which is the North African and Middle East region, where there is a lot of cultural and societal stigma around this vaccine. And as an advocate for this, we call our healthcare professional colleagues, but also all other stakeholders, to act now and make Life-Course vaccination the standard, and to not make any exception. It's how we strengthen health systems, protect our most vulnerable, and build healthier, more resilient societies together. Yeah, so I think we can move together ahead for better immunization coverage, and certainly uptake by the societies if we commit to these actions and make them a real lived reality in our everyday lives. Thank you.
Thank you very much, Balkis. And I will take your call for lifelong commitment for immunization to open a second round of discussion with our panelists. And I would like to invite you all to make a very short statement to move from theory to practice, to make sure that the very important words that are in the call to action become a reality. And I will start from the other way around now, starting with the young professional, because they are those that will have to work longer to make sure our health system are protected and our communities are healthy. So I ask again, Balkis, to make 1 minute statement. I know I ask you all to make 2 minute statement, but we are running out of time, and I'm sure you can make it in 1 minute. To make 1 minute statement of what you think your organization can and will do to make sure the statement is implemented.
Sure. I should start.
Yes,
Okay.
please.
So from the Junior Doctors Network of the World Medical Association, we are committed to making our voices heard and to making ourselves one of the leading advocates for life-course immunization. What we can do is to talk more about this on our social media platforms to our colleagues across the globe. We so far have more than 1,000 members, so all of this will be leveraged to make the case throughout many countries around the world and to raise awareness, not just between ourselves but also among our communities.
Thank you very much, Balkins, and we really count on the young generation for that. Zaineldin and then Tanushree.
Yeah, Marta, thank you so much. As a representative of the International Federation for Medical Students Associations, we are guided by our policy documents on vaccination, which is rooted in evidence-based advocacy. And it's truly inspiring to be part of this panel with leaders from multiple organizations. And like I said, we represent over 1.5 million members, and we have so much knowledge and capacity to reform and spread awareness about vaccination. And this panel is a great springboard for meaningful youth engagement. I really want to emphasize this because having youth at the center on the table, creating the policies that shape lifelong vaccination access and ensure that everyone from the global south to the global north have access to vaccination is crucial. That is why at IFMSA, we committed fostering partnerships that amplify student voices and to applying robust data and research in everything we do, and to champion equity so that no community, urban or rural or whatever geographical location, refugee or native, lacks access to life-saving immunization. And we will continue to learn, adapt, and also partner with everyone so we can really achieve those goals. So let's take this moment to really advance and start. It does not stop here, and it does not stop at this panel, and we have the power to really achieve lifelong immunization for all. So thank you so much.
Thank you very much, Tanushree, and then I go back to Graeme.
Thank you, Marta, for the floor. IPSF represents about 500,000 pharmacy students and recent graduates from more than 100 countries around the world. And we have the power to bring about change and let this call to action not be just a statement, as I stated before. So we reaffirm our commitment to advancing vaccine equity, confidence, and access throughout all stages of life. In alignment with the call to action on life-course immunization, IPSF pledges to continue leveraging its global youth network to promote immunization as a lifelong public health priority. Our commitment spans from the first championing pharmacist-led immunization by advocating for legal frameworks that empower pharmacists with proper training to administer vaccines and support immunization services. By expanding vaccine education, collaborating with academic institutions to integrate comprehensive immunization training into pharmacy education worldwide. By combating vaccine hesitancy, designing and delivering evidence-based, culturally sensitive campaigns that combat misinformation and promote vaccine literacy in communities. Fostering youth engagement by mobilizing pharmacy students as vaccine advocates, educators, and frontline supporters of immunization programs, and promoting inclusive access by urging governments and partners to ensure vaccines are safe, affordable, and accessible to all individuals, including marginalized and vulnerable populations. We remain dedicated to protecting global health through sustained advocacy, education, and community engagement. And we call on all health and youth organizations to join us in advancing vaccine access and confidence for all at every stage of life. Thank you.
Thank you very much. Graeme, over to you.
Well, the IFA have, well, first of all, I want to say one thing to people on the screen tonight, how wonderful it is to see the brilliant youth coming forward, and you are so inspiring. We desperately need you. So the IFA has a long history here. It's probably our #1 agenda for the last decade. We have the resources, and we remain very committed to a Vaccines for Life program. And it will keep on working with a new Secretary General, a new team in place, previous team, Dr. Jane Barrett, who ran the IFA for 20 years, and her team carried this candle, carried this torch in a fantastic way. So I want to pay my respects to her as we say this. But the IFA is there, we have the resources, and we are very committed to this one big issue. It does disturb the IFA, and it disturbs me personally, that there is this, I don't know how you explain this, but there's a new agenda how vaccines are bad for you, and vaccines are bad for the world order. But that's, to us, it's total rubbish. We believe in vaccines, and we believe in vaccines for life, and we remain rock solid committed. Just a few things to emphasize here, Marta. At the halfway point between two big critical global agendas, if I can say to you, the United Nations Decade of Healthy Aging and the Immunization Agenda for 2030, we believe there's a need to assess the accomplishments made to date, and to bring forward examples of good policy and practice, while also driving continued action to meet the aims of these two big agendas, and they are fantastic agendas. As I just mentioned at the outset, our biggest concern is the marginalised, not always marginalised, but marginalised and very vulnerable populations in all of our countries throughout the world, and people with severe disability. They can be left behind. We have to fight for these people. And our #1 concern is adults, older adults, and adults with disabilities, whether they are physical or mental or emotional, are not left behind in this world that's changing at a very rapid rate. That's our focus, and it remains our #1 focus forever thus. Thank you.
Thank you very much. Paul, and then David.
Thank you, Marta. The call to action is actually a call to advocate at local, national, regional, and international levels. And FIP, through its 158 member organisations representing more than 4 million pharmacists, pharmaceutical scientists, and pharmaceutical educators worldwide, will give them will give them the resources to advocate within their country, within their state, within their communities, to recognise, either by direct contact with the public who they serve each day, or by contact through policymakers and politicians, to recognise the potential, the capacity, and the trust that resides within every community within their pharmacy workforce. By doing so, they can empower pharmacists locally to do more, to deliver more services, and in particular, to be involved more aggressively with a Life-Course vaccination. So FIP sees our role as promoting information, promoting resources, and promoting the ability of our members to advocate on behalf of our profession. You see on my background, Think Health, Think Pharmacy. We are also running at the current moment a global campaign on Think Vaccination, Think Pharmacy. It's about making people aware that pharmacies are places of primary healthcare provision, and included in that is provision of pharmacist-delivered vaccinations. And we will continue to advocate through our members on that basis. Thank you, Marta.
Thank you very much, Paul. David.
Yeah, thank you very much. And the ICN is very much committed to this. And we have over 130 members representing nearly 30 million nurses globally. And we're truly committed to advancing Life-Course immunisation through advocacy, policy development, and collaboration with global partners. Look, we want to empower nurses to lead immunization efforts through advocating for their role in vaccine administration, education, and policy making. And we want to do that with our NNAs, or National Nursing Associations, and our partners in the World Health Organization and others. We really, as an organization, we prioritize continuous education, and we have our upcoming Congress in Helsinki, which is the largest gathering of nurses from over 110 countries. We want to provide them with the latest scientific evidence and, to combat vaccine hesitancy and promote confidence. We really strongly advocate for safe working conditions, and this includes access to vaccines for healthcare workers. And look, we also develop numerous guidelines and position statements that have a huge impact on nursing and national health systems globally. We want to continue to strongly advocate for the ongoing investment of education and professional development of nurses across the continuum of care. But in addition, I mean, this is a really important forum because, as you've heard, particularly from Pharmacy Group and from others, we really need to break down some of the barriers between the health professions to make sure that we provide optimized model of care. And this is a great initiative where we all come together, but there's much work to be done on that. And we're strongly involved in trying to optimize this model of care by working with other health professionals. So we want to promote equitable vaccine access, particularly in underserved populations. And we want to make sure it's integrated, particularly throughout the life course journey and throughout primary healthcare systems. So thank you very much for this opportunity to share.
Thank you, David. And before calling the other two speakers, I would like to invite participants to type their question in the chat. We will not have a lot of time to answer a question, but maybe we will be able to pick one or two as we finish with this roundtable discussion. Jason, over to you, and then Mehmet.
Thank you. As others have done, I'll introduce the WMA very briefly. It's an organization that represents physicians around the world, and it brings together national medical associations in order to do so. The WMA represents over 10 million physicians globally, with more than 115 national organizations. What we're committed, and we've already committed to do, and we've done in the past years, and we'll continue doing, and we hope to do it with others that are on this call. And we're very glad, as others have mentioned, to have youth colleagues, including those from the WMA's own constituency, represented here, and is to encourage governments to commit resources to immunizations programs to target their specific country needs, and to make sure that those needs identify and prioritize populations that are at greater risk of vaccine preventable diseases. And we can do so through our expertise of analyzing that risk, but also through our influencing capacity through those national medical associations, which oftentimes have strong ties with some of the key decision makers in health systems where they operate. We also wish to work on strengthening vaccine confidence by disseminating accurate science-based information, both through our own work, but also through the work that happens at national levels. And we're committed to strengthening medical ethics, including the ethics surrounding information and disinformation that can spread if those regulatory structures are not strong and capable of fulfilling their mission around those objectives. So lastly, I mentioned at the beginning, but we're committed to continuing to collaborate with the other organizations here, but also other organizations that may wish to join us in this important work of strengthening lifelong immunization. Thank you.
Thank you, Yasin. Mehmet, and then over to Michael for the closing remarks and eventual question.
Thank you very much, Marta. Actually, first of all, I would like to say that I agree and share all these statements of the colleagues, and I'm very happy to be here with all these committed organizations. So maybe the biggest commitment is actually on working together on this action. So if I elaborate a little bit more for the commitments of WFPHA, firstly, we commit advocating for national and regional policies that integrate life course vaccination within strong, resilient primary healthcare systems. So the vaccination must be a routine expectation at all stages of life, not an exception. So secondly, we will work to strengthen family doctors' abilities to recommend and administer vaccines confidently and compassionately. We will do so through the dissemination of educational resources, the provision of targeted training opportunities, and access to evidence-based communication tools. Thirdly, we commit to promoting community engagement, ensuring that immunization efforts reflect local priorities and address barriers to vaccine access among vulnerable and underserved populations. Finally, we will continue to collaborate closely with partners of this goal and other global partners like WHO to support strong immunization infrastructures and expand equitable access to the vaccines worldwide. We are committed to translating this call to action into measurable improvements in population health and community resilience. Maybe as a last closing remark, I would like to say that vaccination is not only an act of prevention, it is an act of solidarity. It is how we protect our future together. WONCA is proud to stand with all of you to ensure that no one is left behind at any stage of life, anywhere in the world. Thank you.
And thank you, Marta, for the opportunity to make some closing remarks. You know, I think one of the things that came through most clearly, and particularly from young professionals, was the word trust, and you built on trust again and again. And, you know, measurements of trust are really interesting. Go back 2 decades and I was a politician. Politicians' level of trust was not as high, as in fact it was quite low. And so it increases significantly when you move to being a health professional. And particularly our pharmacists, nurses, doctors are really very, very high on the trust level. And that actually adds a responsibility for each and every one of us. And you mentioned your number of organisations internationally, your number of members, and the World Federation of Public Health Associations is in a similar way, where we need to encourage our associations and our association members to use this trust that we have to deliver the evidence-based information on life course immunisation. That's why the call to action. So we're very, very proud of this particular task that we undertook to bring people together. And for those who are listening and for those who are on the panel, if there are other organisations that should be part of this, please send an email to the World Federation or contact any one of us and let us expand our group beyond what we already have to ensure that we get the highest level of capacity building and advocacy that we possibly can. And to build on what Paul was arguing, don't forget it's not just appealing to the general public, it's also policymakers, both at the bureaucratic and at the political level. All of these things work together to ensure the best possible vaccination rates right across the life course. This call to action has taken a lot of work, and I think we've got it right at this stage. No doubt it will be developed as we go on further and more ideas come in, and we're very happy to build on it. But thank you all for being part of the coordination, part of the effort, and most importantly, part of the thinking to get us to where we are today. I'd also like to thank the World Federation staff and support for the support of this initiative, along with the University of Geneva and Pfizer. I think it's a great initiative. I'm really proud to be working with each and every one of you and with each and every one of your organisations. I think we can make a difference, and that's what we need to do. So thank you all. Thank you, Marta.